Have you ever wondered if there's more to fighting cancer than just the standard treatments? What if we could target the very fuel that cancer cells use to grow and spread? Today, we're diving into a fascinating and emerging field: metabolic therapy for cancer. Let's start with the basics. Healthy cells and cancer cells have very different ways of making energy. Most of our healthy cells are flexible. They can use glucose or sugar, but they can also switch to using fats, specifically ketones, for fuel. This is called metabolic flexibility. Cancer cells, on the other hand, are often incredibly dependent on glucose. They are sugar addicts, using a process called aerobic glycolysis, also known as the Warburg effect, to rapidly produce energy for their uncontrolled growth. They're not very efficient, but they are fast, and they gobble up huge amounts of sugar to fuel their expansion. This is where metabolic therapy comes in. The core idea is simple yet profound. If we can cut off the cancer cell's primary fuel supply, glucose, we can essentially starve them while still nourishing our healthy cells. How do we do that? The most well-researched approach is the ketogenic diet. This is a very low-carbohydrate, high-fat, moderate protein diet. By drastically reducing carbs, your body shifts from burning glucose for energy to burning fat. This process produces ketones, which most of our healthy cells, including our brain cells, can happily use for fuel. But many types of cancer cells struggle to use ketones. They're metabolically inflexible and wired to depend on sugar. So, a ketogenic state creates a hostile environment for cancer while our healthy cells thrive. Now it's crucial to understand that metabolic therapy, like the ketogenic diet, is not typically recommended as a standalone cure for cancer. Instead, it's being studied as a powerful complementary or adjuvant therapy. Think of it as a 1-2 punch. Standard treatments like chemotherapy and radiation work by damaging or destroying cancer cells. Metabolic therapy works by weakening them from the inside out, making them more vulnerable to these conventional treatments. Research suggests that this combination can be more effective than either approach on its own. It's about creating a comprehensive strategy that attacks cancer from multiple angles. The science behind this is growing every day. Studies are exploring how a ketogenic state can reduce inflammation, decrease growth signaling pathways like insulin and IGF-1, and even enhance the effectiveness of certain cancer drugs. It's a dynamic field with a lot of promise. However, this is not a do-it-yourself treatment. Implementing a therapeutic ketogenic diet, especially during cancer treatment, requires careful medical supervision from an oncologist and a dietitian who are knowledgeable in this area. They can ensure it's done safely and effectively, tailored to your specific situation. So what's the takeaway? Metabolic therapy represents a paradigm shift in how we view cancer, treating it not just as a genetic disease, but also as a metabolic one. By exploiting the unique metabolic weaknesses of cancer cells, we can open up new avenues for treatment. This is a hopeful and exciting frontier in oncology. If you found this topic interesting, please give this video a thumbs up and subscribe for more deep dives into the latest in health science. Thanks for watching.